Hello, classmates. Today, I will be speaking about miscarriages and infertility. I will start by explaining how I organize this PowerPoint and what I will introduce. I will be speaking about causes of infertility for both men and women. Afterwards, I will share with you the experience I had interviewing Isabella. Then, I will talk about why miscarriages happen. Leading to that, I will talk about my experience interviewing Angelica. I will also talk about rates and statistics for both male and female in regards to this topic and share my experience interviewing Benjamin. Lastly, I will speak about treatment options and what I have learned with this experience. Infertility may be caused by many factors, including problems with egg or sperm production, genetic, age, or too much exposure to certain chemicals. For men, low sperm count or abnormal sperm function may be caused by different things. These include genetic defects, enlarged veins in the testes that can increase blood flow and heat, both of which affect the number and shape of sperm, exposure to chemicals, alcohol use, steroid use, or even overexposure to heat. The causes of infertility in women can include many of the following: athletic overtraining, stress, poor diet, too much exposure to certain chemicals like alcohol, pesticides, radiation, or chemotherapy, sickle cell disease, kidney disease, and also diabetes. Isabella is a 28-year-old woman in my ward that has been dealing with infertility for over a year now. She has been trying to have a baby with her husband for a long time, and they haven't been able to have any. She shared her experience with me and told me how she felt the first time she realized she wasn't able to have a baby. She shared the following with me. When you get married, infertility is not something you really think about. When I first started to realize that I couldn't get pregnant, I was scared to go to the doctor and have him tell me I had a problem. I didn't want to have a problem. I didn't want to be the problem. After going to the doctor and having the doctor tell me that it was an issue of fertility, I remember just breaking. I have had a stressful life, and even though I kept myself very healthy, I never imagined I would go through this situation. Luckily, I have had my husband by my side the whole time, and we hope that one day we can have a child of our own. But for now, I'm fighting the battle, and I hope to win it someday because I'm in pain, and I hope God can help me heal and receive a blessing. She also pointed out that sometimes she would feel angry because she believed it wasn't fair that she was going through this. However, now she recognizes that God has a plan and that she should just follow it. A miscarriage is the loss of a baby before the 20th week of pregnancy. The medical term for a miscarriage is spontaneous abortion. As many as 50% of all pregnancies end in miscarriage. About 15 to 25% of recognized pregnancies will end in miscarriage. Symptoms of miscarriage include bleeding that goes from light to heavy, severe cramps, belly pain, weakness, worsening or severe back pain, weight loss, contractions, infection, medical conditions in the mother such as diabetes or thyroid disease, hormonal problems, immune system responses, and physical problems in the mother. Angelica is a 21-year-old that experienced miscarriage 2 months ago. She's a close friend of mine, and she shared with me how the experience happened, and I recorded the following. Me and my husband were super excited that we were going to have a baby. Everyone in our family knew about it, and I was only 3 or 4 weeks pregnant. For a few days, I started to feel very dizzy, and just not myself. I was feeling sick for some reason. I didn't know what was going on. One day, when I was talking to my husband in the table, I don't remember much, but he told me that I was off and not paying attention to him. He then told me I fainted, so he called 911 because he didn't know what to do. When the paramedics arrived, I started to wake up, and my husband insisted that we had to go to the intensive care or the hospital. I insisted I didn't want to go, but we went anyways. That was when the doctor told me that the baby was detached from my uterus. I was shocked, sad, and just couldn't believe it. He gave me some medication so I could have the embryo out of me. The night was horrifying and painful once the embryo was out of my body. I felt like the world was crashing over me. I didn't even have a chance to name him. During the survivance period, 8,744 active women of childbearing potential were diagnosed with infertility for the first time. The overall incidence was 79.3 per 10,000 per year, shown in this table. Infertility of unexpected origin was the most common diagnosed type, followed by another specific origin, anovulation, tubal origin, and uterine origin. The cause of male infertility is unknown in up to 40% of cases, and while many infertile men have oligospermia, low sperm concentration compared with reference ranges, or azoospermia, the absence of sperm and semen, some infertile men have normal sperm concentrations. A total of 17,542 active competent servicemen received an incident diagnosis of male infertility, for an overall incidence rate of 32.3 cases per 10,000 per year. The majority of the incident male infertility cases were unspecified male infertility. That would be a 71%, followed by azoospermia, 9.3%, oligospermia, 8.2%, and other male infertility, 6.9%. From 2013 to 2017, annual numbers of medical encounters during which male infertility was recorded as a primary first listed diagnosis, 21.8% between 2013 and 2017. Benjamin is a 36-year-old man recently diagnosed with azoospermia. He shared the following experience with me. Benjamin explained that he had an accident riding a bike and later on was told by the doctors that he had obstructive azoospermia. He expressed it as a tragic surprise. He has 2 children, but wanted to have more. He also expressed that he was afraid to do surgeries or try to repair the problem, because he was afraid that nothing could help him. However, he remains calm and blessed that he had the opportunity to be a father twice. He expressed gratitude for the people that supported him and were with him during those difficult times. Although there are no specific treatments to avoid miscarriages, there are ways to prevent it, like manage stress, exercise regularly, eat healthy, well-balanced meals, keep your weight within normal limits, don't smoke and stay away from secondhand smokers, avoid illicit drugs, and make sure you are up to date with your immunizations. Common fertility medicines include tamoxifen, metformin, and gonatrophins that can help stimulate ovulation in women and may also improve fertility in men. There are several types of surgical procedures that may be used to investigate fertility problems and help with fertility. This can be through endometriosis or correcting an epididymal blockage and surgery to retrieve sperm. Also, assisted conception, such as the IUI and the IVF, and egg and sperm donation. After doing my research and interviewing the 3 amazing people I presented in this PowerPoint, I realized that I should never take things for granted and that supporting people going through these situations is crucial for their emotional health. All these individuals mentioned were in a lot of pain, and support from their family and friends really made a difference to carry on. I learned to develop empathy and compassion for these people. Thank you for your attention, and I hope you enjoyed my presentation.